Hello, my name is Shannon Brooks, and I'm doing a presentation on fifth disease. Fifth disease is also known as parvovirus B19. It is more common in children than it is in adults. 25% of infected individuals will present with a rash. That is the main symptom that children will present with. And adults can present with joint symptoms similar to rheumatoid arthritis. What is parvovirus? Parvovirus is a small single-stranded DNA virus that infects and replicates cells to the bone marrow and blood. It occurs worldwide and it can come out sporadically or it can come in clustered outbreaks. Between 50 to 80% of adults do have the IgG antibodies, showing that they have had the prior infection in the past. The routes of transmission are it can present, it clinically presents different based on your age. It also is respiratory. It transmits from person to person. Although it's not associated with respiratory symptoms, but it can be found in respiratory secretions. Young children are the main source. Saliva, sputum, nasal mucus, any droplets, that is a route of the transmission. It is a close person-to-person contact. 50% of affected individuals are family members and are infected within their own home. For pregnancy, a vertical transmission pregnant can become infected and transmit it to the virus to the fetus. It also can be transmitted through blood products that contain the virus and urine. Symptoms for pregnant women, they will present with mild fever, sore throat, flu-like symptoms, the bright red rash, the slapped cheeks, that is what the main symptoms of children also, and a raised rash all over the body. For a diagnosis, you want to test the positive IgG antibody and negative IgM indicate that there is a maternal immunity, meaning that there is a past infection. Presents with the slapped red cheeks. Positive IgM antibody is a diagnosis for the parvovirus. Differential diagnoses include roseola, rubella, measles, group A strep infections. You always want to review the history of their vaccinations as well and review their symptoms to rule out if it is parvovirus or something else. During pregnancy, we definitely rely on the IgG and IgM if suspected. So you want to take a test, and when it has the positive IgM, that is the diagnosis. The first 20 weeks, they are at a risk of having a fetal loss if they are present with the virus. Circulating IgM can be detected approximately 10 days after exposure and just prior to onset of symptoms. IgG antibodies are detected several days after IgM and usually persist for years. The second half of their pregnancy, you want to do weekly ultrasounds, and you want to evaluate for fetal hydrops for at least 8 weeks. And the fetal death is an outcome for when they have it, and for severe anemia. Intrauterine transfusion of RBCs is indicated to prevent fetal death. For the plan of care, mainly with the slapped red cheeks, there is no specific treatment. For chronic infections, people with anemia that have received immunosuppressives therapy, examples of that are cancer, leukemia, HIV. These patients would receive IVIG with reduction of immunosuppression if possible. You can place them also on droplet precautions. Since parvovirus is spread close to close contact, they will have contact precautions. as well. Education, you want to always review infection control, good hand washing, not sharing food or drinks, covering face when sneezing and coughing, avoid close contact with anybody else who is ill. Pregnant women should avoid schools, anywhere that there's an outbreak setting, because it is common in children, and daycares and schools are where somebody who is pregnant wants to avoid. Good infection control is the best option for education, because as long as they're doing the good infection control, they will decrease their chances of transmission. Treatment for symptomatic, the manifestations, like I said, for just the red slap cheeks, there is no treatments. Anyone who presents with arthritis, they can take NSAIDs as long as they are not pregnant. Pregnant women cannot take NSAIDs similar to Motrin or anything else. These are the other types. The fetal high drops is the intrauterine blood transfusion that I discussed. And chronic infections also, they have the intravenous immune globulin and transfusion. Risks of fetal death for pregnant women is less than 10% and between 2 to 5% of individuals. If the patient has indications of possible parvovirus, you should recommend avoiding contact with other pregnant women until it is ruled out. It's uncommon to cause congenital anomalies. Babies rarely develop severe anemia caused by mother's infection. And remember, the main cause is household exposure and transmitted through close contact. And that is it. Thank you so much.